Hi everyone, my name is Joylene Rojas, caregiving student from St. Augustine School of Nursing, Lipa City Branch. Welcome to my demonstration about obtaining pediatric vital sign. Before we begin, let me introduce my nephew, Adnan Chavez. Hi! The vital signs that we are taking today are body temperature, height, weight, respiratory rate, heart rate, and blood pressure. So collect and prepare necessary equipment, then sanitize your hand and verify patient's identity. Explain the procedure to the parents or the guardian and specify ways in which he or she can help. For the equipment, we are using Sphygmomanometer, stethoscope, a thermometer, we have there the scale to obtain the weight and the height, and a watch to count with. And now we are obtaining height and weight. Stand. Okay. And the height is 135 centimeters, so you have to document it for accuracy. And then the weight is 35.6. Depending on the child age and level of cooperation, you can take tympanic temporal or auxiliary temperature. So we are using the thermometer. We are going to turn it on. And I'm gonna put in the CR. So we're gonna wait for the thermometer to beep. Okay, it's beeping. And the temperature is 36.4. So we have to document it for accuracy. Remember, the child pulse rate or the heart rate can increase with activity, anxiety, illness, or environmental temperature. So record the pulse rate in the patient's record right away for the accuracy. And now we are obtaining the heart rate. So we have to place a stethoscope at the chest of the child at the 5th intercostal space at the mid-clavicular line. Listen for the apical beat and count for 1 full minute. So one full minute, 1 beat is equal to 1. I'm gonna show you how or where is the 5th intercostal space. Here. Here's the clavicular line here under the neck. So we have to count for 5 for the 5th intercostal space. 1, 2, 3, 4, 5. And down here. So here is so we're gonna place a stethoscope. Relax. Okay. So the heart rate is 90. So you have to document it right away for the accuracy. And now we are obtaining the respirations. For the respiration or the respiratory, observe the child's chest or place your palm there and count his respirations for a full minute. If the child's breath too quickly or hold his breath, ask him to breathe normally, then record the respiratory rate. Okay. Okay, so I count for 1 full minute and the respiratory rate is 22. And now we are taking the blood pressure using the sphygmomanometer. So make sure his feet is on the ground, flat, and that he is sitting upright in a nice position just like this. Okay. Okay. Sit just like this. Flat on the floor. Okay. And then also that he doesn't need to go to the bathroom. So because that can negatively affect blood pressure. And then no crossing of the legs. And then at least he sat here and he rested for 5 minutes. And we have here the equipment. So we are using this one, a cuff, and then we're gonna find the pulse on the brachial artery. It's usually towards the inside of the elbow. It's here. It's here. Here. Okay. Then gonna pump. Okay, so the blood pressure is 100/60.